Hi there. This is my last and final. Um, Hi there. This is my last and final presentation on internal and external bleeding. So, first of all, what is bleeding? Bleeding is a loss of blood from our arteries or veins or capillaries. It is either internal or external. The external bleeding is usually obvious because it's typically visible, obviously. And internal is usually often difficult to recognize. And whether it's uncontrolled bleeding, either internal or external, it can be life threatening. So we have to make sure that we control it right away. If we lose a large amount of blood in a short amount of time, it's called a hemorrhage. And left untreated, severe bleeding and injury and sometimes unreversed problems can happen. The types of bleeding are, as we said before, capillary, venous, and artery or arterial. The most serious is arterial. As we know, our arteries are major parts of our body, so the blood will be spurting blood, pulsating flow, bright red color blood. Venous bleeding is the next serious. This will be more of like a steady, slow flow, darker red in color. The capillary one is more of like an abrasion or a small cut, slow, even flow, bright red color. The golden hour is what we refer to as the period of time when a severely injured patient has the best chance of survival if the surgery is performed within an hour time frame. Danger of dying from shock or excess bleeding during this period is most likely if they don't get in this golden hour. What causes hemorrhages? Bleeding or a hemorrhage is a name used to describe blood loss. It can refer to blood loss inside the body, called internal bleeding, as we know, or outside the body, called external bleeding. So blood loss can occur at almost any area of the body. Internal bleeding occurs when the blood leaks out through a damaged blood vessel or organ, and external bleeding happens when blood exits through the break in the skin. And as we know, we just learned from the different bleedings, there's arterial, venous, and capillary. How can you help? Well, one of the most important things we can do in an emergency is to recognize and control severe bleeding. So we want to make sure that we act quickly and do not wait for shock to develop before providing care to someone who's injured or suddenly ill. If not controlled properly and the person loses a significant amount of blood, this can lead to shock or possibly even death. So always follow the safety procedures, including but not limited to make sure that you use proper PPE. We want to protect ourselves from their blood, bodily fluids. So either using gloves, protective eyewear, shields, whatever it might be. Obviously, you want to wash your hands and don't touch your face, your mouth, or your nose. And of course, avoid eating or drinking after touching a patient who is bleeding. All open wounds need a bandage or dressing to protect the area, slow down blood flow, and prevent infections. Your teacher will further instruct you on how to bandage all those areas. But some methods include immobilization. This helps immobilize the limb to restrict movement while maintaining direct pressure. This will help restrict the blood flow. Also, we can use pressure points. There's several of them. If other methods do not control severe bleeding, consider taking the measure of compressing an artery supply. So these are called pressure points on the body. Okay, so you apply pressure to the underlying bone as a specific site. And then the other option is a splint. If there's an open wound to an extremity where the bone or joint is also injured, these can actually, the bone ends or fragments can be displaced and cause damage to the soft tissue and blood vessels. So using a splint can help protect this area further so that the bleeding can be contained or it can stop. This is a picture of a tourniquet. It's another method to hopefully stop the bleeding that's bleeding profusely. I couldn't get this video up here, but here is the URL if you wanted to watch a video on how to apply a tourniquet. Okay, moving on to internal bleeding. We have some symptoms here: lightheadedness or weakness in the head. There can be vision changes, shortness of breath. Obviously, they affect the lungs and the chest, shoulder pain, tingly hands or feet, nausea or vomiting, just pain. Um, they could be coughing up blood. Patient could be guarding the area. They could have rapid pulse or breathing. The skin could look moist or pale or ashen and bluish. Declining level of consciousness and a drop in blood pressure. So there's lots of symptoms there. You might not be able to tell because internal bleeding is a little bit more difficult. Now, if serious internal bleeding is suspected, of course, we want to call for more advanced medical personnel. But while waiting, ensure the patient remains as still as possible to reduce the heart's blood output. We want to care for shock. So, looking for shock could be the lookout. We want to be on the lookout for a weak pulse, bluish pale skin, rapid breathing, and restlessness. In closing, remember, as an EMR, the most important thing we can do in this situation is to recognize and control breathing until a more skilled professional arrives at the scene. Also, trying to keep your patient safe and calm also helps the situation. Thank you and have a great day.